So, lymphedema. Simple question as we start out, what is lymphedema? Well, like I say, we're going to get into a little bit of medicalese here, but not too much. The key points of what do you need to know about lymphedema. Lymphedema is the buildup of fluid in the soft body tissues when the lymph system is damaged or blocked. The lymph system is a network of lymph vessels, tissues, and organs that carry lymph throughout the body. So lymph in this case would be that fluid that leaked out of my leg. Lymphedema occurs when lymph is not able to flow through the body the way that it should. And there are two main types of lymphedema. Primary lymphedema, which is the version that I have, is a genetic condition. Primary lymphedema is far less common than the secondary form. It has been estimated to occur in 1 of 6,000 individuals, predominantly in female patients with a ratio of 1 male to 3 females. In the majority of lymphedema cases, the lower extremities are affected. As I mentioned here already, the lower extremities is definitely where I have the problem. The way you can easily think of the lymphatic system is that it's basically just broke down into 4 chambers: left, right, upper, lower. So if you have a condition that is affecting one part of the lymphatic system, say your left leg in particular, in my case, that doesn't necessarily mean that you have problems everywhere else. It can affect just one part of the lymphatic system. The other form of lymphedema that exists is called secondary lymphedema. While the secondary lymphedema is caused by blockage or damage to a normally functioning lymphatic system, resulting from surgery, radiation, trauma, or other known insults, the formation of primary lymphedema is caused by pathology affecting the lymphatic system directly in the form of a developmental abnormality, most commonly hypoplasia or hyperplasia involving lymph vessels and or lymph nodes. So to translate this a little bit, generally secondary lymphedema occurs when you've had some sort of damage to the system. A common way that this happens a lot of the time is with cancer. You know, cancer often either is in the lymph nodes themselves and has to be removed, or in the process of removing things like tumor, infected tissue, the lymph system gets damaged, and then you result with some sort of flow problem with the lymph in your system that then causes the swelling. And that's what James is doing in particular these days, is working at a sort of cutting-edge cancer research facility type place that they treat all forms of cancer. And so he's trying to educate and get these cancer patients treated that are mainly dealing with secondary lymphedema. But primary lymphedema, while being pretty rare, is what I actually have. So I didn't have any actual injury or surgery or anything like that 100% caused this to happen. So the next part is, what is the lymph system? Well, parts of the lymph system that play a direct part in lymphedema include the lymph, which is the actual fluid. It's a colorless, watery type fluid that travels through the lymph vessels and carries T and B lymphocytes. Lymphocytes are a type of white blood cell, and as probably most people remember from high school, white blood cells are pretty important. Lymph vessels are a network of thin tubes that collect the lymph from different parts of the body and return it to the bloodstream. So these are the, obviously you could think of this like sort of like veins or something like that. It carries the fluid around and eventually puts it back into the bloodstream. And then the actual lymph nodes are small bean-shaped structures that filter lymph and store white blood cells that help fight infection and disease. Lymph nodes are found along a network of lymph vessels throughout the body. Groups of lymph nodes are found in the neck, underarm, I don't know how to say that word exactly, mediastinum, abdomen, pelvis, and groin. This is interesting because when I went to the first, and we'll talk about this a little bit more as well later, but when I went to the first clinic that I went to get treatment, a big part of what they advocated for was something they call a massage in order to stimulate the lymph nodes and the lymph vessels in order to try to push this fluid out. And what I begin to realize is that all of this lymph that the lymph nodes and vessels, transport throughout the body, it all kind of comes all the way up through your whole body, and the main place where it dumps out back into the rest of the bloodstream is actually way up in your neck. So they would do a massage that would literally start from my toes all the way up my leg, all the way up the left side of my body, so that's where it was particularly bad for me, under like the armpit, all the way up to your actual neck. So it was kind of an interesting sort of learning process about how that whole thing works, and why when you have a problem, particularly I think in the lower extremities, how it can get so bad, because it really has to pull that lymph all the way up your body, and it's a long journey. And that's why it's so, I think that's also probably why it's so difficult to treat and sort of like keep out, especially like say down there, because one of the biggest things that can help you with draining that excess lymph, in addition to compression, is elevation, letting gravity help you move that liquid along. But obviously it's difficult to keep a leg constantly elevated, because that's the opposite of what a leg is supposed to be for. A leg is not to keep elevated. A leg is to, be pointed downward, So it sort of is a fighting against yourself to try to help with this process when you're going through treatment. The spleen, thymus, tonsils, and bone marrow are also a part of the lymph system, but they don't play a direct part in lymphedema. So your lymph system is a big part of your body, and it's fairly complex, and there's a lot going on with it. So what does lymphedema look like? Well, there are four up to stage 3 severe lymphedema. As you can see, when it starts out, it can look like maybe not a whole lot is really going on, just maybe a little bit of swelling. And then it just sort of gets gradually worse until you get to stage 3, where in particular it's very apparent that something is wrong with whatever extremity you're dealing with here. So this stage 3 here, because like I say, I went for over 25 years without being told what was wrong with me. This is not very different than what my leg looked like. Even especially when I first started getting treatment, but it still looked not much different than that when I met James. Even after receiving some treatment and making some progress on my condition, my leg still didn't look dramatically different than what this severe stage 3 looks like when I first met James. So as you can imagine, dealing with something like that, it affects you in a lot of ways. Not only is it painful, not only is it obviously uncomfortable, it's obviously, it doesn't do much for your self-confidence. You're very aware that your leg doesn't look like a normal leg. And what was very apparent to me when I was dealing with all this, and I didn't know what it was or why it was, is that I would look at a lot of other people that had weight problems like me, and their leg didn't look like that. And I was like, why do my legs look like this, and their legs just look like a normal, somewhat fatty leg? Like this is something that plagued me for years, not understanding why I have all this ugliness with my leg instead of just having a leg that was fat, that just had too much fat on it. It seemed to me that there was a bigger problem. But again, I go to doctors and they say, nothing is wrong, nothing is abnormal, you're just overweight. So now we get into the little bit of the video portion of it, which is, now that I've met James and I'm on the road to getting treatment, what does treatment of lymphedema look like? This first video we're going to watch is going to go over the compression wrapping portion of it. It's a little more on the clinical side, because it's I think it's meant to be like a training video for other therapists. So I apologize if it's a little explainy-y. But I think there's a lot of good information here, and I want people to kind of understand what the treatment process looks like. And I'll pause every so often and add my own sort of experience and insights into it. We're going to watch, but this is going to be the longer video. It's going to be several minutes long, in addition to pausing and stuff like that. But we're not going to watch the entire video. I just want to kind of let you guys see what goes into it and really how much work James put into doing, treating this condition. All the therapists that work there, really, but obviously my experience was with James. But it's a lot of work. It's not an easy thing to treat, and it's also kind of interesting, I think. So we'll get into this one here.